Hi, I'm Kim McCarl, the Communications Officer for Contra Costa Health Services. Our department has been fielding many questions since we announced the extension of the shelter in place through the end of May. I'm here with Dr. Chris Farnitano, who's the health officer for Contra Costa County, to talk about a variety of topics that people have been asking about. So obviously the safety of kids is of highest priority, and we've been getting a lot of questions around childcare and what is and is not allowed around childcare. So first let's talk about who can get care for their children. Is it just essential workers or is it anybody?
So the child care guidelines allow child care and other child activities for workers, essential workers, outdoor workers, other workers that are allowed to go to work under the health officer order, including those who are working from home.
And so tell me how the child care setting should be managed in the safest way possible. How many kids, how to keep it clean, some of those kinds of details that we think are really important for people to understand.
There is an understanding that children, they're sometimes hard to keep apart. And so because of that, we have guidelines that say that the child groups should be in small groups of the same kids, groups of 12 or less, not a different group of 12 each day, but the same group of 12 with the same adult supervision every day. So it's not mixing, and so if there is some spread of COVID-19, it's contained within a small group.
And so do the kids have to wear masks?
Kids are not required to wear masks. It's often difficult for kids. It's not even recommended for young children. So the idea is we're accepting some level of risk, but we're trying to keep it under a low level by keeping the group in a stable, small group.
What if my child care provider wants to do one group of kids in the morning and one group of kids in the afternoon?
That would be allowed as long as those groups don't mix. They don't overlap in the middle of the day.
So summer camp is kind of a similar situation that we've been getting lots of questions about. So lots of families have already signed their kids up for these summer camps. Tell me what would be okay and what to watch out for.
So again, camps are considered along the similar guidelines to childcare. So these are activities for youth or children. They have to be in stable groups of 12 or less. And we really recommend that if you're doing a summer camp activity, it's in the same camp or same activity for at least 4 weeks. Many parents are used to putting their children in one camp for 1 week, one camp for a second week. While that's allowed under the order, the recommendation is really to keep in the same group of 12 over at least a 4-week period, so you're not mixing with different groups every different week.
We want to thank Dr. Farnitano for being here today to help us understand these questions. There's a huge amount of information available on our website at cchealth.org, and we update it constantly. We really encourage you to spend some time there looking at our frequently asked questions, and then also to let us know what questions you have so we can do a better job of making sure that whatever information you need is included on our website.